First and foremost, I am a parent. I'm a parent of three boys, one of which has autism, one with ADHD, and the other one with chronic stubbornness, and he's probably the hardest of the three. So I started this journey. Let's see, Jaden is 8.5, probably about 3, and it took us a year to get a diagnosis. He was diagnosed with classic autism. He was in the first percentile for receptive language. I, at the time, actually my entire career has been in insurance, medical billing. I'm the child of a physician, and I was raised to crush the bones of insurance carriers. That's how we grew up talking about it, and that's my background. Some people sing and dance, and this is my challenge. So I make sure they pay. I make sure families get covered. And now, actually, interesting enough, I have stepped into the belly of the beast and helped some insurers implement a benefit. So I figure that's not going to hurt the industry at all, helping them. Let's get that coverage out there. And I think a lot of these executives, actually one of my best friends, oddly enough, is the wife of the CEO at Aetna. So, I think they want to do the right thing. And once they get the funding and the mandate, and, it's administering these programs in a way that you can access them. So this lengthy page document, we're not going to go through every single detail, but it's a list of trial and error things that I experienced. Because when I came into this and Jaden was diagnosed and I called and I, obviously I'm going to get coverage and authorization, and I know insurance inside and out, and I know the form and the box, and I know all this stuff. And then I hit this roadblock where you live in Utah. Sorry, you're out of luck. And knowing what I knew about the insurance industry and contracting and networking, I said, wait a minute, where am I funded? What state is my plan funded? And they said, oh, let me transfer you. And find somebody else. Oh, let me transfer you. Finally find out it's funded out of the state of Florida, which implemented a mandate, one of the first states to do that. So he had coverage. And we got started very, very quickly. But looking at that process and seeing my friends go through these similar experiences where 3-6 months to get a pre-authorization for services, once they lose the battle of covering it, then the battle becomes delay. Let's see how long we can stretch this out so that I'm not covering it, right? So that's what we're going to talk about today. So I'm going to start with I'm going to briefly touch on some of the things that Mike and John had covered. So you want to ask the right questions. Once you know, are you self-funded? You go here, does your company offer an autism benefit? Yes? Great, let's get started. No? Then let's keep fighting. And they gave you some options for advocating. There's also another option that I want to mention. Some companies only honor the mandate. They're self-funded, but they only honor the mandate in the state in which you live. So like Comcast, for example, they will honor mandates in states that you live. So you need to understand how your company administers that benefit. Now moving on to private insurance. I mentioned you ask the funding state for your plan and check your little map and see if it's green, and then go find out what your coverage is. If it's not green, then you've got some additional work to do, and I will talk a little bit about some things you can do. You're not dead in the water. If you don't have ABA coverage, don't give up. The fight becomes harder, but you still do it. Okay, so yes, you're covered. We'll go to the getting covered section. If you're not, then you can actually ask for authorization for specific conditions that are comorbid with autism, and still you won't probably get ABA coverage, but you're going to still get coverage for psychology appointments, psychiatry appointments. You may even get some occupational therapy appointments. I helped somebody get equine therapy that could not get ABA, which is so bizarre, but we find these sneaky ways to kind of get around it. So do not give up. If there's one thing worth not giving up for, it's your child. So in this condition, so you're not under a mandate, your company doesn't cover it, you're in a state that doesn't cover it. You can unbundle, is what I kind of say. You can use speech delays, different codes, and there's a coding primer in the back where it gives you some of the codes for generalized anxiety disorder, which most of our kids have some form of that. So you want to get covered, but you don't want to say my child with autism is having general anxiety disorder. You want to get coverage for code 300.00 because that will be covered. But if you put 299 dot something with an autism code, you're going to get denied. So the way these systems work, it's not a human like you see on Incredibles, denied. It's a system issue. And so we experienced that with a new mandate too. You'll see system issues where you're submitting a code and it's not working. So be creative, let's do something else. I mean, you can't invent codes that they don't have, but they do have comorbid conditions that we know about. So I gave some examples. So a lot of people will call and they'll say, I have a little boy with autism. He's suffering from general anxiety, or he has anxiety. Do you cover that? Well, no, we don't cover autism. So a better approach is, does my plan cover outpatient psychotherapy? Notice I said the specific condition for my 5-year-old that's having a general anxiety state. That's a much more clear question. Your best move is if you've got the procedure code and your diagnosis code, combine those and say, does my plan cover this procedure code for this diagnosis code for my son, Sam, with this date of birth on this date of service with this provider? Give him the tax ID. So that way you're not giving them, saying he's being treated for autism, which he has, and that's linked to your anxiety state or sleep disorder or sensory issues. So that's a little bit of help for if you don't have coverage. So don't put that 299.00 on anything, and we'll talk about ICD-10 codes that come later. So you just want to make sure that your provider is billing for the condition that they're treating. And a lot of times they'll think it's autism, and it's not. So I will specifically tell my providers when I go in, I would say, you're treating anxiety, you're a psychologist, I want it billed under this code. You can do that. So now you do have coverage, great, let's figure that one out. So I'm very, very rigid. I have some of these compulsive behaviors that my son has, and I'm very rigid about the way that I approach my insurance carrier. I document. And so the first step, if you take away nothing from this day, from this night, I want you to take away step number 1. And that is always ask and document these questions for every interaction with your insurer. And I also do for my providers. And now the school. So I'm the queen of documentation. And at the beginning of every call, what is your name and your employee number? And I've had people say, I don't give that. This is mental health department. We're nervous about security. That's ridiculous. I'm not talking to you. I'm going to call somebody else, or can I have a supervisor? Because I need to know who I'm talking to and what they told me, and is it true? And then I ask, are you noting this call? Yeah, I am. A lot of times they'll note the call, but they're not detailed. You ask, are you noting this call? They better note this call, and you are too. And I let them know that. And I'm very polite, I'm very sweet, and you're doing a great job, thank you for your help. But at the same time, I'm very direct, I am noting this call. At the end of the call, can you read me your notes? Oh, they hate this, because you just went through like an hour call where you were just like, specifically, what does that mean? And at the end of the call, they have to read you notes. And I will go through, actually, you specifically said these words. Is that accurate or not accurate? Nothing worse than hanging up, thinking something's covered, and then you get a very large bill in the mail. What is the reference number for this call? Very basic information, but save that reference number. I can't tell you how many times they're like, we have no record of this call, or you didn't call, you haven't. No, actually, the reference number is this, and I spoke with Cindy, employee number 54320. After the call, I review terminology, make sure I understand, because these companies use terminology differently. What is a pre-cert to Aetna is not the same thing as a pre-cert to United Healthcare. So look at your terminology and know it, and use their terms. When you use their terms, when you speak in their language, you know this with your child. You speak in their language, they get it. Use ABA on your insurer. Speak in their terms, right? And then at the end, just to be safe, this is very rigid, but when I'm authorizing $30,000, $50,000 worth of services, I'm not going to get stuck with a bill, and I'm going to call back and I'm going to verify it, and I'm relentless because I want to know for sure that what the person told me before, Cindy said it's covered, I want to make sure that there's not a catch. So for larger dollar services, I will call twice, and I did with ABA, and I actually ended up calling multiple times because I did not get the same answer, and until I got the answer twice or 3 times from different people, I was not satisfied because my family can't financially handle $30,000 to $50,000 at that time. The next thing you want to do is find out your procedure codes and diagnosis codes that are going to be covered. We are going through a change. Most of you won't be very familiar with the change in coding that's going to happen starting October 1st. Some of you providers are like shaking in your boots and terrified, and I am too. I work with a lot of provider groups in my profession, and we don't know exactly how it's all going to play out. We know as much as we can know from research, but until we start billing and getting denials, then we're going to have to figure out that game. But the codes changed based on DSM-5, and the code structure changed. So when I was saying 300.0, that's an old code. The new code for generalized anxiety state is going to be on your coding primer. So at this point, I'm going to skip over to that coding primer, and it is on page 9 of 9. So it's your last page. I'm going to give you just a very basic overview for parents that aren't familiar with this. And it's unfortunate you need to be a jack of all trades, but if $30,000 to $50,000 sounds too high of a price tag for you to pay personally, you do need to be familiar with this. So ICD is the diagnosis set of codes. And previously we were using diagnosis codes from the set 9, which is 299.00 for autism spectrum disorders, and then there's subsequent .01, 09. There's different subsets of the autism spectrum disorder. We move over to DSM-5, you actually start with a number, and anybody who's an IT geek, or a letter, anybody who's an IT geek here will appreciate this, because your leading zeros in Excel disappear, and your old codes were horrendous. So new codes, they do start with a letter. It's a great thing, but it's different codes. So now when I'm looking up generalized anxiety disorder, I'm using F41.1. You as a parent can Google this, look on the CMS website. You can become familiar with these codes that you're using, because when you get denials, you'll want to know what this means. So services are authorized, really there's 4 components. You've got your procedure code, which is what am I doing? What service am I rendering? You have your diagnosis code, which is what am I, what's my condition? What am I treating? So what am I doing? What am I treating? And then you also have a date of service. When am I doing that? That will determine eligibility as well. Am I covered at the time? Is my provider in network at the time? So your date of service matters. You need to pay careful attention to that. And then you have your patient. Is the patient covered? So you've got these different tenets of coverage that you need to be aware of, because they may change over time. So that's just your primer. This is not a comprehensive list, but these are some codes that I have used, and some of these tricks of the trade that I have employed. So going back to, I was on page 2. Some of these questions you need to ask. First, I start by asking, can I get a summary of plan description and SPD? I need that document. I need to be able to know what's in that document, specifically referencing behavioral and mental health. I need to understand that, and I need to be able to point out it when they deny and say, which line says that? The next thing, if you do not have a provider in mind, then you can call your insurer and you can ask them what diagnosis codes they accept for applied behavioral analysis or psychology or psychiatry visits, some of those kind of things, and make sure those codes are covered. And document those, because sometimes you say ABA generally, but is it the supervisor visit? Is it the implementer visit? Is it the evaluation? There's different codes, and sometimes I've seen insurers, this is ridiculous, they require supervision, they cover the tutor, but they don't cover the code for the supervisor. So they require a supervisor, they don't cover it. You're nodding, yes, this happens. And so you need to understand those kind of things. And I've gone to bat on that and had them change. They actually require a code that they don't cover to do codes that they cover. So make sure you understand specifically the code. Otherwise, you're speaking in general terms and you may get an answer that is not accurate. Also, you want to know if the procedure code and diagnosis code combination is covered in network and out of network. Sometimes you don't have out of network coverage for behavioral therapists. And so you get started, and the worst thing is you get into it, actually they're developing a relationship, money aside, you've got this great program going, and then you get the giant check in the, the giant bill in the mail, and it's like they're out of network. Like I did everything right, and now it's not working. Or they're out of network for this time period, like their network agreement expired, or they're actually a network provider that starts in 2 months. So all of those kind of things, you just want to avoid those surprises. Make sure that you understand your network coverage, in network versus out of network. And for those providers in the room, this is a very frustrating thing. This is one thing I do professionally, and it's helping providers to do those network agreements, get on the panel, renew all of those things. It's so much paperwork, and a lot of providers where you're small business owners and you got into it for the love of children and autism and behavioral therapy, and now you're doing paperwork, which is not what you love. So that's a very frustrating thing. And so as a parent, you can take some of that off. And I know we have providers in the room, so I'm going to put you on the spot. I'm going to ask how many of you have an abundance of clients and you're still trying to take on more because they need help, but you've got a waiting list. You're overburdened. Anybody? Anybody? Every provider here is nodding their head. You as a parent, you might be competing with the person next to you to get a great provider. And so that means you got to run fast. And there's no shame in fighting hard for your kid. So if you are the parent that aggressively goes after an insurer and makes sure that you have all the pieces in place, you love those parents, huh? They hand you a single case agreement and everything's ready to go and billing works smoothly. You're the parent that gets the pick of providers. You know, I was a parent who was able to fly somebody in of my choice out of Florida to come and set up this program at their expense because I negotiated a rate that was like out of this world. Because I was that parent who made sure that all of my ducks were in a row and handed it to the provider and made sure that money was not going to interfere with the coverage, with the treatment plan of my child. Okay, so if you do have a provider in mind, you can kind of reverse the order of these questions because your provider probably has done some of this legwork for you. So you can ask them what codes, what procedure codes and diagnosis codes do you use for these services when I call my insurance carrier? And they may already know you have Aetna, you have Humana. This is what we typically do. And they may not know, and you have to do the legwork. But ask them, and then you can call your insurance carrier. Make sure you know the tax ID when you're calling them, because if you use a name, you may be messed up. Some providers are in there twice under different NPIs. Some provider, there's a lot of Cindy Johnsons in the world. So make sure you have the tax ID when you call, and make sure that you specify the authorization period. So dates of service. Are we doing this in May? Are we doing this tomorrow? When are we getting services? Okay, so then verify your network coverage. If you do not have your provider in mind, you can call your insurer and say, do you have a list? And for providers, you can call your insurers and say, insurers you're interested in, and say, can I get on your list? How do I do that? So a lot of times I've seen, so if I look up a OB or I don't know, an orthopedic surgeon, which I needed recently for my son. If I look them up, I can find paneled providers. When you look up ABA providers, is it easy for you to get on that list? Where is that list? Where is it? We don't know where that list is. It's a phantom list. A lot of times, literally, in PHP, I know it was on like an Excel spreadsheet that one person in the office knew. So you might have to call and request that list. I've had him email it to me before. So as a provider, you can call and say, how do I get on this list? And kind of sweet talk your way around until you find the right person, where Joanne over in Suite E5 has this list, and that's where patients are directed to. Let's see. If you do already have somebody, you need to ask your insurance if your preferred provider, using the tax ID when you ask if that preferred provider is an in-network provider for that date of service. And it'll be a range, you know, obviously you're starting at a specific time, and when does that network agreement end? So keep track of that, because sometimes network agreements lapse and you don't want to be stuck with a bill as a parent. If your preferred provider is in network, then you want to know that expiration date. So I just said that redundantly, sorry about that. If they're out of network, you have to ask a bunch of questions. In network, so a network agreement, your insurance carrier has negotiated a rate with a provider, and they've agreed to pay that rate, and they're not going to balance bill you. You're going to have your copay or your co-insurance, whatever agreement they have with you for patient responsibility, but you're not going to be stuck with an overage. If your provider bills at $125 an hour, insurance reimburses $95. Your provider has agreed to accept $95 an hour, and you will not be billed for the remaining $30 if they're in network, right? So if they're not, you've got to ask a bunch of questions. You want to verify all your coverage limits, because you may have a different deductible. I might have a $5,000 in-network deductible and a $10,000 out-of-network deductible that's totally independent. So you want to be aware of what your out-of-network coverage is. The other thing that is extremely helpful, I don't know that there's a reason you should be in an out-of-network provider. And you're like, well, there's no network providers on my list. The reason is because if there's not a network provider within 60-mile radius of your home, and that may change by plans, but within a certain radius of your home, you can request a single case agreement. And what that does is essentially bring that provider in network for you only. So single case agreements, a lot of providers don't do them because they're cumbersome. But if you want that provider, then you can go and get a single case agreement yourself. And I know providers really appreciate that because a lot of them are, the margins in behavioral therapy are slim and in mental health in general, but specifically behavioral therapy. Those of you who've done it, to employ somebody to chase down these single case agreements is, it's not feasible financially. So, so you bring them essentially in network. You can request that based on specialty requirements. So let's say I want a psychologist and a specific one that I know specializes in autism spectrum disorders in their families. But there's a lot of psychologists or psychiatrists paneled on my plan, but they don't really work with autism, and it's kind of a specific need. So I have obtained a single case agreement for a provider, a psychologist and a psychiatrist that specialize in autism services and their family. And the other thing that you want to be aware of, if you have more than one child, does this affect your other kids? Does it affect you and your spouse and your relationship and your marriage and everything about your life? It doesn't just affect this little guy with autism or little girl with autism. It affects the whole family. So when you do these single case agreements, be aware of relationship-based services. You can ask for that single case agreement to cover the entire family, not just that one member. It saves you a lot of headache because when my son has a twin brother, and when he was showing a lot of signs of anxiety that was related to his brother's unpredictability, to the aggression, a lot of those things, taking him to another psychologist that wasn't familiar with Jaden, wasn't familiar with our family or autism, was not as beneficial. So be aware of that, even if you don't see the need now. This is a family issue. This is not just the individual. Also, as a parent, that's something not to be ashamed of or to ignore. I think a lot of times, even if we're not ashamed, we ignore that. As parents, we need help. If you're going through major depression, if you're going through anxiety yourself, it definitely is related to having people in and out of your home and a child that's unpredictable and all of those kind of things that you're managing. So definitely seek help for yourself and make sure you're covered under a single case agreement with similar providers. Plus, who has time to go to another provider? Seriously, you're going to 5 already. Pre-certifications and pre-authorizations. This one is a tongue twister for me. Are they the same thing? Are they not the same thing? I hear them used interchangeably and differently. In my experience, pre-certification is often referencing a visit required to qualify the condition before you do additional services. So for example, testing for ASD for a diagnosis, what does it run? Anybody know? 1,000? Yeah, it can be, 800 would be great. You're on a waiting list for something like that. 1,500 is not uncommon. So before an insurance company will authorize, they need to pre-certify that they're actually eligible for that level of testing. And there's a separate code. So some of those questions you need to ask. You need to be very specific. Is there a pre-certification or pre-authorization requirement? Because there may be both, but they only tell you about one. So specifically for diagnostic testing, I have encountered that. But sometimes they use pre-certification to mean pre-authorization, which is where the insurance company authorizes that you actually have coverage and are able to receive services that they will reimburse. So as I mentioned, there may be a separate visit and a separate code, and you have to make that appointment. And it may just be a matter of getting them the diagnostics. And that's going to become an issue. Am I okay with a 299.00 code, or do I need that F41. I can't even remember. 84.0, thank you. So the new ICD-10 code, are they going to be re-diagnosed? Are they going to translate that code? How is that going to work with your specific insurer? Because we all know they're making it up as they go a little bit. So the other thing you want to do is call and verify that your provider will accept the usual and customary rates. Now, I have challenged rates on behalf of providers, but also on behalf of my own son. When I got a rate that I felt was unacceptable, I researched the usual and customary rates in that area, and I came back with that's unacceptable. And I live in a rural area, by the way, so somebody's going to have to travel. So I do not think that $54 is an acceptable rate for my zip code. Please reevaluate. And I appealed, and I came up with a very large rate that I'm not going to say, but it ended up making it so that I was able to select from providers that had higher credentials. It also made my providers really happy, which is a good thing because they're in your home a lot, as we heard. Also, other tricks of the trade. This comes back to terminology. We had an experience. My son was going through some psychotic episodes. Grandpa decided to show him the real Spider-Man with the spider, and those of you with very visual kids, and the fangs, and we were having hallucinations in the middle of the night, and he was on melatonin for sleep problems, and I think we're having hallucinations related to that. And 4 nights in a row, I woke up to a child screeching, naked, running out the door because he couldn't have anything touching his skin, and there were spiders crawling out of everywhere. And on 4 days of that, you can imagine it felt very urgent. It was not a sustainable situation. So I call, and it can take up to 14 days to do a pre-authorization for a psychiatric appointment for your son. And I was just devastated. So put down the phone and I recouped, and then I called again. And they said the same thing. And I said, ma'am, do you know how much sleep I've had in 4 days? It hasn't been a lot. And I talked to her and she said, okay, you didn't hear this from me, but you can request an urgent, emergent, ad hoc request. And you just say those words. So I'm requesting an urgent, emergent, ad hoc request right now. And I had an authorization within 24 hours, and we got him to see the psychiatrist and had a microdose of Klonopin, and we got sleep. So you can use that. I wouldn't abuse it. Certainly not because, okay, I'm very urgent about getting services for ABA right now, but it is a tool at your disposal. And sometimes you find that person that has some compassion, and if you don't, you can hang up and try again. They're a dime a dozen. You'll get somebody else, right? And that's my, well, that was another point. If you skip down, if at any time you're running into a brick wall, you don't have to talk to this person. They aren't the end all be all of this. They're making it up too. They aren't given very clear definitions. I know people that work there, and sometimes they're like, you know what? I am just tired and it's 4 o'clock and I don't want to deal with you and you're scary. So you can hang up. Thank you for your time. Get the reference number and then call back and talk to somebody else and say, you know, I know this isn't your fault, but I just talked to Joanne and she must have been having a bad day. Can you please help me out? I know that you're probably going to be great. And don't waste your time with somebody that's a brick wall. You can also request a supervisor at any time, and sometimes that's just the effective way to go. I've sometimes had days where I started with, what's your employee number and can I talk to your supervisor? Because you get to that point. So don't give up. Also, always check your bill against your charges. I can't tell you how many times, okay, my out-of-pocket max was $5,000 and I hit that in February. Why am I getting a bill in March? But so many people, and I think not autism parents, it's a necessity, they pay their bill. I got a bill. I don't pay it till it's red because they didn't do it right. So really check your bill, make sure they calculated your patient responsibility correctly. And the last thing I was going to talk about is engaging your support system. So there are people in your life that are bulldogs, and they are not as tired as you. And so you can request a limited power of attorney. You can find a college kid that's like studying law. You can find somebody that will take this when you can. And sometimes there's a required form. In the state of Florida, there's actually a legal medical surrogate form that you fill out, and I actually am a legal medical surrogate for several people so that I can call and bulldog their case and advocate on their behalf and not be in tears because it's not my kid, but I'm fired up and I'm going to get this taken care of. So use your support system. Don't feel bad if this isn't your thing. My sister, she was like the amazing ABA mom. She was the one who was not going to do the cookie. That wasn't my thing. But I was the one who was going to get the coverage and I wasn't going to take no. And so helping her sometimes when she's like, I don't know what to say. You say it so well and it makes sense, and so I would call on her behalf and help her figure some of these things out. And you may have people in your network that can do that. And sometimes it just takes time. It just takes somebody who's willing to put in the time. I think it was probably 3 hours a day for 3 months before we got a 3 authorization. That's a lot of time. And I wish I could balance bill them for my time because of the amount of effort it took me to just get a pre-authorization I was clearly entitled to. But I hope you leave today feeling empowered. Like this mom over here, you don't give up. My son was in the first percentile for receptive language. And by kindergarten, he was in the 50th. And we just really, you do what you have to do to make that happen. And so I know I'm running out of time. So the last thing I want to cover, there's a page on appeals and denials, and you can look through that. It gives you the address of the insurance commission. And I start out with filing a claim because I know they're wrong. So I just file it because I want it on their records. When we were doing advocacy, they're like, nobody files with the insurance company. Nothing's wrong. I'm like, nobody knows how to file with the insurance company. But I do file denials if I feel like I'm being treated unfairly or I'm doing an inordinate amount of paperwork to access the coverage I'm given, then you can file that and complain. So please complain to the insurance commissioner. So this page on page 8, alternative options. I want you to not feel helpless. Okay, if you're in a risk pool where you absolutely can't see any way to get coverage, you can, but you're gonna have to think outside the box. And you may not get exactly what you want, but you keep fighting and keep trying. So one option I found, actually, higher education in a green state. Some universities cover ABA and you can buy a student plan. Now that's expensive, but hey, it might be a good idea to get a master's degree and pay $30,000 for that while treatment is covered. Some of those kind of options are available. You can join and look for companies in a green state. Look for Adobe. Look for companies that cover it. You are a consumer when it comes to healthcare, and sometimes we feel victimized that we're not the consumer, but we are the consumer, and you can make those choices. Last, I wanted to talk about one other option. So I've done trade work. I've done free seminars. I've gone, providers sometimes have training clients. Get creative and make sure that you're doing something, even if it's not everything. Keep trying. And one option, so I was covered under a PEO, which is a professional employer organization. And I recently helped a dentist in Utah form a PEO for his own business. And what a PEO does is it pools companies together so that they're basically a larger company. So smaller groups of dentists come together and they're a larger company, but they still operate independently, but they do their taxes and HR together and they qualify into larger group plans. And so that's one way that I was able to get coverage. So if you don't have coverage now, you can reach out to the Utah Autism Coalition. Use those Facebook groups, those networks. Network as a community. I want to see questions to Utah Autism Coalition saying, I have United Healthcare and they're mandated and they're giving me this problem, or I can't get credentialed with the provider I want, or they don't have a list. All of these, I want to see those questions, because when you combine and you've got 5 people going to Humana saying, hey, this is not right. You told him this, you told her that. What's going on? There's no antitrust laws against parents coming together. And I really think that needs to happen as we implement SB 57, but also across other states. So I hope you leave today feeling empowered that you can do this. You may not have it right here in your lap, but there are things you can do to make it happen for you and your child, and it is so, so worth it. Thank you.